I see a lot of people with pain following surgery. We are becoming more aware of this condition and it's becoming part of the overall conversation about the potential risks and downsides of having an operation. There are many causes of pain weeks after surgery, and it's important we don't miss out any complications such as infections, so you may need to be referred back to your operating surgeon. Some patients develop nerve pain after surgery, and this may or may not be related to actual injury of the nerve. Cutting a nerve can be part of the surgical procedure, and the nerve may grow back more sensitive over time. Sometimes, when the surgeons move a nerve out of the way to get to their operating site, the nerve can become bruised and develop a sensitivity that results in pain. This can be shooting or burning pain in the area and can persist for many years. As a pain consultant, we'll ask about how the pain started and progressed following surgery. During the consultation, we'll talk about our understanding of pain after surgery and the fact that we realise it's more prevalent than we previously thought. A significant amount of the pain is usually described as nerve-type pain, shooting, burning, pins and needles. Sometimes the area can feel strange or even painful to touch. Often it can be incredibly frustrating to be left with pain after surgery that may have been performed to help relieve pain. Some patients need further scans to check for other causes. We sometimes try medications that were designed for another medical problem but were found to be helpful with nerve-type pain, such as drugs originally for epilepsy. These medications like gabapentin and pregabalin are strong painkillers, but do come with a risk of side effects. These include drowsiness, weight gain and constipation, and we must remember that some anti-epileptic medication can cause congenital malformations. Injections may be an option, but a long-term reliance on injections may not be beneficial for lifelong pain management. Some people need surgery, but remember, surgery may have contributed to the current pain problem, and there's no guarantee that further surgery will fix it.
When a person develops pain in an area that's been operated on, a big problem is something called fear avoidance, which is avoiding certain movements because you expect them to lead to pain. This leads to further weakness and inflexibility in the muscles in this area, worsening the pain in the long term. We will work with you to counteract this fear and get the area moving. It's worth noting that already doing some regular light exercise before any form of surgery can be helpful, encouraging you to continue with this post-surgery and also prevent weakness, which can help with managing your post-op pain. It's important that we work with you to develop a structured physiotherapy plan that takes account of your individual circumstances. If you stick with the exercises that are taught, you aren't going to be damaging yourself further. Allowing the muscles and ligaments in an area to weaken and become less flexible is likely to lead to further pain in the area. So a graded approach to exercise will build your strength and function gradually.
Pain that persists for a long time after surgery can have a significant emotional impact, including frustration and sadness, and the reasons behind it may be very complex. Generally, when we have surgery, we are aware we may experience pain for a few days or a week, and that's expected. If it lasts a few weeks, the brain can start to worry, and if we extend that to a few months, then stress, anxiety, anger and sadness can build. All pain messages make their way to the brain, and it is the brain's job to then interpret these messages, and as such it is the volume controller of the pain experience. When the brain is under stress or in a state of frustration, it may deal with pain messages differently. Whilst emotional well-being can therefore have an effect on pain sensation and vice versa, the pain itself is very much felt in the body, is real and can be debilitating, affecting many aspects of life and self-identity. Psychologists in the pain team can explore this with you and look for links between your emotions and your pain experience. We can understand together what helps and what is unhelpful in trying to manage both pain and emotions, including identifying thoughts and behaviours, and consider changes and skills that are meaningful to you in connecting to your valued areas of life and well-being, and also in increasing confidence in coping with the pain experience.
I had a hernia repaired 10 years ago, and was told there was some risk of pain, but I wanted the surgery done. Within a few days, I had this terrible groin pain, like a knife stabbing into the area 20 times a day. The surgeons did another scan and said everything was fine, so sent me to the pain clinic. I tried some medication, but it made me really drowsy and I didn't feel safe to drive, so I stopped it. I started to get back problems, so I saw a physio who showed me how funnily I was walking because of the pain. We started some gentle exercises and I'm still in pain, but my back's better now. I think the biggest thing was getting my head around the fact that I had a hernia operation and was now in a lot of pain, and it wasn't going to go away. This took me a long time to process. I was angry, frustrated, and I regretted having the operation. The chats with the psychologist helped because I could get it off my chest and we could then look and plan for the future. I spent so long looking to the past, I've forgotten about the future. I would still like to go back in time and not have the operation, but we are where we are. And I've got to stay positive and get on with my life.